And you're back on, Dr.
I'm
Emer.
gonna take this back from you and put it on this side, okay? Hold there now, on the right. Okay guys, we are now on our last part. The last part of her torture, but the finish line of her happiness for scars is gonna be our active FX CO2. This is superficial CO2. These beams here are very strong, 10 times wider and stronger than the deep. But because they're more superficial, you actually see the scabbing process. So you see here, this is the burnt skin. And why does it look like that? Because it's dehydrated. The skin basically is absorbing, the laser is absorbing all the skin's water, and it's dehydrating it, and it's making that whitish color. Then it's gonna flake off as dead skin cells in the next 5 to 10 days. So just so you guys know, for those that didn't see our last video, look at my goggles at Jason MRMD at Innovative Optics. We have created some custom goggles that I love, that I want doctors to have. They're gonna help you perform better in laser and be more comfortable for your patients. So you guys can see this actually hurts, but she's doing really well. Not only is she strong, but also because she has some nerve blocks and some topical creams. And what we need to do is be very meticulous. If you guys see the scanning pattern, turn all the way to the right a little bit. This is a laser for her scarring. You see the scanning pattern? We're in a hexagon. I like that shape much better than a square because I find it feathers much more evenly and it looks much nicer.
Now, why is feathering important?
Feathering is really important so it's even, so you don't have a line of demarcation. In the old days when the lasers were really superficial and strong, we didn't do fractional. The lasers would leave a line and permanently, and we don't want that. So we're working really evenly. Whole face. Going over the TCA, we're going over the deep laser and over the Fractora, hitting it from every layer so she gets the most improvement we can in her scars. And you guys, it doesn't look like a lot right now, but we're about 80% density, which means that 80% of her skin's being affected, which means that it's gonna have more downtime. Okay, let me take this from you. I'm gonna put it on the other side now again. Go ahead and hold there, perfect. Stay just like that, perfect. Now again, we're gonna work just directly where we were before. Very meticulous, you're okay, I got you. And this laser requires you to be 6 inches or less from the skin. So I can go closer, or I can go a little further, and it won't make a difference. Doing really good. And again, remember, every one of these is gonna heat and scab. Take a look again at our beautiful goggles, Innovative Optics, follow their Insta, and you're gonna see some great goggles coming out by me in colors and shapes. We're excited. And so we did our deep laser here in the circled area. Now we're going over the entire face so it peels evenly.
What is this for? This is for resurfacing the skin. This is for patients that have acne scarring. And she's gonna help, this helps it smooth out. So you see those little dots? That's burned skin. And what's gonna happen is, those white dots are gonna peel, and she's gonna get new skin.
She's gonna have baby skin, which is gonna build collagen and remodel her scars.
You have a clinic in Houston.
I don't, but I have a lot of my patients will get our skincare products first that we'll send to them from EmerageCosmetics.com. We'll do a virtual consultation. And then they'll fly in for treatment, stay a couple days, and go right back. So if you guys want, you can get free skincare consultations at EmerageCosmetics.com, or you can sign up for a consult with me or my coordinator virtually.
And you're not going to get this anywhere else. Like, not that many doctors do it, and not that many doctors do it as much as Dr. Emer. So you need to go to someone that is very versed doing these treatments, because you can get complications.
And especially her with her ethnic skin tone, with, she's higher risk of causing issues. So you want to really go to somebody that knows how to protect you the best as possible This is a controlled burn, you guys. This is not something you, excuse me, but F around with, okay? You know what I mean? I wouldn't. So I want it to be perfect. And I will tell you, I'm very meticulous when it comes to these.
Should this laser work on stretch marks?
It does, but I don't like this type of laser on stretch marks at all. Okay.
Chica Macana said Dr. Emer is hot.
It's hot?
Hot.
Hot?
Yes.
This is hot. Okay, thank you. I appreciate it. All right, let me take this back. Okay, she's basically done. I'm gonna go over the nose. Hold on. So we're gonna make it a little bit smaller. Go right on the nose, make it easier to contour. If you do this strong enough on a nose, you guys, you can actually reshape the nose completely. It's called rhinophyma repair, and we do it frequently. I'm gonna do an extra pass over the mouth here, so we get some of the deeper scars. Okay, so you guys can see this is why it's extremely important to have a really good goggle, as I gotta go all the way around the eye here.
And these are actually really good goggles because they're really thin and they have this rubber that makes it easier for Dr. Emer to go around the eye.
See? And if I hit it, it doesn't damage her eye. Okay? It protects her.
Does it burn the hair and does it grow back?
What?
Does it burn the hair and does it grow back?
It does not. It can burn the hair, and yes, it would grow back. I'm also going to give her a little tightening around her eye really quick, right here. That's called the Madonna lift. Because Madonna was one of the first people. Now, I'm going to go over a little of the TCA spots, just an extra pass, some of the bigger ones, the blend. I do this on an angle, okay? This is a special approach to hitting these scars and blending them properly. And I always make sure the edges are all even. We call feathering. Okay. Blending, blending. Good. Turn all the way right to me. Always go to the edge, just a little on the edge of the hairline. Blend, blend, blend. Make sure it's all even so there's no marks that are left. Perfect, you guys. Okay. So now, here, okay? Last part. Perfect. We're going to take this off. We're going to take this off and we're going to apply some PRP and healing products. So we're going to apply now for healing, you guys, hyaluronic acid.
No, it does not smell bad actually.
So this is Emerage Skin Hyla B. Okay, and this is hyaluronic acid, very high strength, high potency. This gives you back the hydration, because remember, what did I tell you the laser did? It burnt the skin and it got rid of all the hydration. So now we're rehydrating. That's important. To make your skin heal, you need it to be hydrated.
So we need a skincare regimen after this to boost results or improve healing?
And you guys, even if you can't come to me and do this treatment, you can get the skincare from us virtually.
Where? Where can you get this skincare?
You can get it at emeragecosmetics.com. And there's a section for packages, and under there it's all the stuff I recommend for these type of lasers. Now we're also applying PRP. I'll have Rosa show you guys. This is her blood plasma, and this helps her heal. So now what I'm going to do is go more aggressive. What?
What's the gel?
This is more hyaluronic, and that's just going to help give her more moisture. And then also I'm going to go a little deep over her deep scars with the microneedle to push the PRP into the skin. Okay? You don't need to do super aggressive with this, just light, penetrate superficial channels, get that PRP in. And that's it. And then we get her to heal.
Would you recommend, like, for the next 24 hours she does, or from here, like, we've done
I'll tell you right now, oxygen facials, hyperbaric oxygen therapy, and then we have a whole regimen on what to do skincare wise. It's ablative laser package at MirageCosmetics.com, but you guys, we're gonna put on a cooling mask right now and the PRP. And that's it. And then we will do testimonial and we'll follow up with her over the next 2 weeks. Bye guys. Okay, now you get to rest actually for after an hour or so.